Hi, this is Dr. Michael Graham. He is from US, Michigan.
Yep.
And welcome to Mumbai, India.
It's great to be here. I'm so privileged to meet you and to see your clinic, and it's very exciting to be here. Great time.
Thank you
Yeah.
so much. How's been your visit to India?
Wonderful, wonderful. Everybody's been so friendly, and it's now my second home. I love it. I can't wait to come back again.
Good,
Yeah.
great.
Yeah.
So let's talk about this new stuff which you have for your
Right.
flat foot. Do you want to
Yeah.
talk about it?
Yeah, well, flat feet has been such a huge problem all around the world, and especially for pediatric patients, that they've been told that they're just going to outgrow this condition. And so, what is your thoughts about that? Do you think that all these children that have the misaligned feet, that one day they're just going to automatically grow back to normal?
No, I don't think
Yeah.
so. I don't agree with that.
Right.
So yes, I do get. I don't know much of pediatrics, but I do get people from their teenage onwards and
Right.
through the whole adulthood.
Right.
And yes, I get a lot of adult patients who said, I've always had flat foot.
Right.
And I lived with it till age, say, 50, 60, 70. And why do I get symptoms now? And I wish they would have done something when they were younger.
Right.
The other side is the pediatric or the adolescent or the teenage patients who do have some flat foot, and they do have some symptoms. Now the symptoms can be quite variable to the extent where they don't know they have symptoms,
Right.
but they are just being non-athletic. That itself is a symptom.
Exactly.
They are not athletic because they cannot run, and that probably has a negative effect on their whole mindset as well, I would think.
Right.
A psychosocial, I would say.
Right.
So that itself is a symptom, but nobody's recognized them, and they've just been sent to physiotherapy to active neglect treatment. Now I don't think so that's a treatment. What's your take on that?
Yeah, I mean, absolutely. I'm a podiatric surgeon, and so we were taught about that we use these orthotics, the arch supports, that this is the miracle cure. And so I made all of these orthotics, and I just watched the patients just walk right over it. So when that didn't work, what was the treatment that we would do? It's the nuclear option, basically. So, so now we're going to tell our patient what's like the traditional treatments that you would offer a patient.
So suppose if a patient has a severe flat foot, and they have gone through this whole treatment protocol of insoles, orthotics, and AFO. It means I've seen patients with AFO, with a 12-year-old guy,
big bulky brace on their ankle, horrible.
Yes, horrible, and the compliance is very, very poor.
Right.
Then the last option for them is a surgery, and the surgery is not a small surgery where you're breaking bones at 3 levels. Like you have the hind foot where you say you break the bone here, you break the bone. So you break the bone here, you break the bone here, you break the bone here, and then you have to do a lot of muscle release at the back. You have to tighten all the ligaments at the front. It's a big surgery and a small feet, and the recovery time is very, very long. I mean, looking at least 6 weeks to 3 months. In spite of all this, the tissues are still lax, and they still need a long-term rehab program. So, what is your take on that?
Well, exactly. So that's we had all of these complications that can happen from all of these other procedures. And one of the things that we noticed with that leads to misaligned and flat feet is that it has to do with the partial dislocation of the ankle bone on the heel bone. So why should we have to cut here and cut in the midfoot and the forefoot when we have this ankle bone that's just rotating out of alignment? So a while ago, actually a few decades ago, surgeons started putting different devices in between the ankle bone and the heel bone. They would even drill screws into the calcaneus, the heel bone, and then the ankle bone would be smashing into that, and there's so many complications that can happen. So it just seems like it makes sense to put some kind of a device right into this space. So this space is called the sinus, which just is an open space. Tarsi is the hindfoot bone, so the sinus tarsi. So so there's different devices that were just placed from one side of the foot to the other side of the foot. And we even have video that shows how the ankle bone is just smashing into the other devices and it comes out. So I use those devices, but there's a high failure rate. And so I said, okay, we have to make something better. And that's when I invented this implant, which is called HyProCure. So this little spacer just is pushed into that naturally occurring space, and now the ankle bone still has all of the normal motion. We just take away the excessive motion. So anyway, so now that we have this great implant that's here in India, and we're so happy that you are a center of excellence that is providing this option when indicated. And so that's patient selection is very important. So maybe you can go through some of the patient selection criteria of what you're looking for and what kind of symptoms you see in patients.
So it was quite great, and I appreciate your time which you spent today in my clinic, and you're giving almost like 2-3 hours. We've seen quite a lot of patients, the Indian patients, and you've seen the whole variety of cases, and we've seen from a child of 9 to a lady of say 69. And we have a great variety of cases in India. I think, as you rightly said, pure and patient selection who is appropriate for this device is the key thing for the success of this implant. And I think you, over a decade of your experience with this implant, you would have found that. Having said that, you could do one thing which I have learned in the last few weeks with Michael is you can do this implant isolated, where you do not need to do anything other than a 1-inch cut and put this implant along with any additional procedures. And today in our clinic we found that few of the kids or few of the patients, even adults as well as kids, could isolated have this implant. While other cases who are more advanced, where you cannot do only isolated, you can add other surgical procedures along with it. And I think that's the beauty of this product. And I think as long as we can get those indications correctly, patients will benefit a lot from this.
Well, and that's what's so amazing about this procedure is that it only takes about 10 to 15 minutes to make the small incision over the outer ankle bone, and then we figure out which size stent is going to fit that space to give us the motion. So now afterward, we don't have to worry about like patient compliance with other kinds of shoes and these other big braces that some people are told that they have to wear, especially here in India, where it's a barefoot country. I mean, everybody, the tuk-tuk drivers are in their bare feet. Everybody's walking around with sandals. They don't want to have shoes on. I don't want to have shoes on. As soon as I get home, my shoes are off too. So, so now that we have a great internal option and that gives us lots of advantages and lots of options. So that's great.
Good. One thing which I wanted to ask you was, how's the recovery with this stent? I know you call this as a stent, not an implant. I think which is a great thing. Tell me what's your take on why it is called a stent, and then about the recovery.
Okay, so we have this space that's closing over. That's just, without the implant in there, the space is just being closed down. So what happens in your artery when the artery is collapsing? We put a titanium stent in there that keeps the artery open. So this is not like an implant. Is usually we think of, you cut out the joint and we're putting in a joint replacement. This is a complicated surgery, a long recovery, lots of physiotherapy afterward. And we don't do that with this because that space is already there. And so all we're doing is just like the artery, we push it in and it's like a press fit and that's it. Afterward, patients are pretty much walking right away. The first couple of days, take it easy, just go to the kitchen, go to the bedroom, watch TV, whatever. After usually a couple of days, then you're walking more, and usually we like to say at least 6 to 8 weeks before any running or jogging. So, and then after that point, then you should be able to do whatever activity you want. You don't walk on this stent either. The weight of the body goes to the joint behind it and in front of it. So after 16 years, 60,000 cases, we don't have any kind of fractures or arthritis. The worst thing, which is actually the best thing with this procedure, is that it's reversible. So if somebody had some prolonged pain in that area, we can make the incision and pull the stent out and no harm is done. And a lot of times the correction's even maintained for the patient, but we don't know how long that benefit will last. So so it's just a great in-between option. So,
and the other thing, one thing which I learned when I was doing the the cadaveric dissection.
Yeah.
The key thing is to make sure that it is implanted properly. I cannot stress the fact that this implant or this spacer, I would say, or a stent has to be done in a very precise manner, and for that you need a proper and good training, because as you said rightly before, the lot of other implants were put in directly under the bone or into this bone or into here, and if you do not do this properly, correct me if I'm wrong, the complications can be higher, like it comes out, or it can fracture, or you can damage the joint. Is that correct?
Yeah, that's why we have, it seems like a simple enough procedure, and it is once you know what's going on. But here in India, we're very select of who is going to be able to use this procedure. They have to go through intense course. So we have these full, very limited training and centers of excellence, and that's what we have here is a center of excellence in Mumbai. So you're definitely very highly qualified for patient selection and surgical technique. So I'm very impressed by your skills and with the facilities here. So that's why if somebody has misaligned feet, flat feet, this is the place to come. This is where you need to be seen, to get the x-rays, to have somebody that knows what they're doing. So, and it's easy for other surgeons. This is something else that I really want to point out. It's easy for other professionals out there that are not familiar with this procedure just to say, those things don't work, and to just blow it off. That is so horrible, because patients take thousands of steps a day, tens of thousands of steps a week, and millions of steps a decade. In every single step, it's wearing out the feet, knees, hips, and back. And so, and then your health in general, like you were saying. So this is an extremely important diagnosis to make with the misaligned feet, and we need to fix it. We can't just ignore it anymore. Like, too many people are suffering with it. So.
And it's quite right, as Michael has said. India has a population of around 20% with flat foot. And as Asians per se, we are congenitally ligamentous laxity is there in our genes. Okay, so we see a lot of patients who have quite a flexible flat feet, and over a period of time they progressively get worse. And if these people are caught early with early symptoms, I'm not saying asymptomatic. I think asymptomatic, yes, you can do a careful watch, but as soon as they start getting symptoms, I think, and if they've exhausted other methods of treatment, I think this is one of the great devices we have in our hands.
That's right. You have nothing to lose. So that's wonderful.
Thank you so much for coming and visiting our clinic.
My
I really
pleasure.
appreciate it, and hope you have a great visit in India.
It already has been. It's been great. Thanks so much.
Thank you so much.
That's great.
I am Dr. Pradeep Moonot from Mumbai Knee Foot Ankle Clinic.
And I'm Dr. Michael Graham from Macomb, Michigan.
Thank you for watching our video.